Louise has been experiencing panic attacks for the past few weeks. A few years ago, she experienced something similar, and although the medications seemed to help her back then, Louise is keen to learn some strategies to help better manage her panic attacks. In addition to a referral to a mental health professional, her GP has also recommended that she try an eMental health treatment program. Louise's GP explained how research shows that evidence-based online treatment programs can be a beneficial treatment option for those with mild to moderate depression or anxiety. eMental health programs can also be a therapeutic starting point for those not ready to talk face-to-face with a mental health professional. Louise's GP had searched the Beacon website, a free online mental and physical health portal, for information about the program that he recommended. Information about many eMental health programs and resources developed in Australia can be found on the Beacon website. The programs and resources are categorised, reviewed and ranked according to the strength of the research evidence that supports them. On Beacon, Louise's GP found a number of different eMental health programs to treat panic attacks. He recommended a program that he felt would best suit Louise and explained how he made this choice. Louise signed up to the eMental health program recommended by her GP and was pleased to find that she could access information and learn skills to help manage her symptoms any time of the day. She found that she could access the Beacon site from home and review her GP's choice of programs. She also found and searched the Mind Health Connect portal to further information about panic attacks. Louise was nervous at first because she thought her limited computer skills would make doing an online program difficult, but she soon found the program engaging, user-friendly, flexible, mobile, and most importantly, very helpful. Louise brought her homework exercises from the eMental health treatment program to discuss with her GP at their follow-up appointment. She now feels less intimidated by the thought of speaking to a mental health professional face-to-face. And she also feels less fearful of her panic attacks, and she has a better understanding of the attacks and their triggers. So whether your patient is a depressed 18-year-old who refuses to see a psychologist or psychiatrist, an anxious 30-year-old woman who wants to know more about her symptoms and condition before seeing a mental health professional, a 58-year-old man with an alcohol problem who has come to you for a referral face-to-face treatment, or a grieving 70-year-old widow who isn't sure if there is reason to speak to anyone about her problems, there is probably an online program that will help you help them manage their mental health. Regardless of whether they live in a major city, a regional town, or on a rural station miles from their neighbours, as long as they have access to the internet, there are treatment options just a click away.